Hello, my name is AM2020-Wiendl. I'm presenting this poster on behalf of parts of the ofatumumab group. This is a program investigating the effects of ofatumumab, a monoclonal antibody against CD20. And here, with respect to immunoglobulin levels and infections in multiple sclerosis. You can see the author's disclosures here, and this is the background. The background is that CD20 directed antibodies are directed against B cells, which eventually produce immunoglobulins. And a known and expected effect would be the lowering of certain immunoglobulin subclasses. And this is exactly what has been looked in the phase 3 Asclepios trials, the lowering and the association of immunoglobulin levels, IgG and IgM, with infections and in general the dose of it. What you see here is the study design and the assessments. It is a head-to-head trial against teriflunomide, an oral comparator, and the assessments were done every 12 weeks. What was assessed was numbers that were screen failures due to lower limit of normal IgG levels before entering the trial, the change in serum IgM and IgG levels, the proportion of patients that become a lower limit of normal during post-baseline, and the association of those lowerings with a infectious event. One has to say that screening for IgM and IgG levels was belonging to the inclusion criteria. Only very few patients did not pass this point, so 99% started with normal levels of IgM and IgG. This is the key slide of this poster, and what you see is that you see a change on serum IgM and IgG levels over time. And if you look on the left side, and what is ofatumumab, the CD20 antibody, is blue, that you have a very moderate but continuous lowering of IgM, but you don't have really a significant lowering over time of IgG. You see a small dip in year 1, and this is even stronger in teriflunomide. And you can actually visualize this important graph, and that makes also a difference, obviously, of this antibody with other antibodies available. The next slide, where you can assume what is the proportion of patients. We don't see really an association with infections, and that is a relevant message, and that is maybe a most important message, that those patients did not differ in terms of likelihood of infectious events, so we didn't see a signal here. So in conclusion, on average, over 2 years, IgM and IgG levels remain in the reference ranges. We did not see an association of immunoglobulin levels with the incidence of infections, and we did not see particularly different and other infections. However, assessment of immunoglobulin levels prior to the start of anti-CD20 therapy might belong and should belong to the mitigation strategy of future problems. Thanks for your attention.